Fatal familial insomnia, what you need to know. What is fatal familial insomnia? How do I get it? What are the symptoms? Is there treatment? What's my prognosis? Fatal familial insomnia, or FFI, is a Pyron disease. A Pyron disease is a condition that typically attacks the nervous system. In humans, these conditions can alter brain functionality and typically occurs in adulthood. FFI mainly affects the thalamus, or your sleep-wake cycle, as well as the inferior olives, or your motor control. The thalamus relays many messages between different areas of the brain. Some of the main jobs are to manage the sleep-wake cycle, the sense of balance, your memory, how we experience pain, your speech, and even our personalities. The loss of neurons, or the nerve cells, in the thalamus prevents it from doing its job, resulting in many of the symptoms of FFI. It also affects a part of our medulla oblongata, the inferior olives. The loss of the nerve cells in this region of the brain results in our loss of control of movements. This is a progressive neurodegenerative disease, which results in fewer nerve cells, or neurons. How do I get FFI? It's a mutation in the PRNP gene. Within that gene, there's a Pyron protein, the PRP. However, with FFI, it's an incorrect shape. It can either be inherited or what's considered sporadic. The PRNP gene is what essentially gives the instructions on how to produce the Pyron protein PRP. There is much unknown about the exact function of this protein, but it is believed to be a significant factor in the transport of copper to our cells, and it's also believed that it acts as a protection for neurons. This gene is located on chromosome 20, and it should have an asparagine. However, patients diagnosed with FFI have a mutation that alters the asparagine and substitutes an aspartic acid. This results in the Pyron protein forming and folding incorrectly, as you can see in the image to your left. This leads to the destruction of our brain. The significant majority of those diagnosed with FFI have inherited this gene mutation from a parent. An individual only needs one copy of the PRNP mutation that causes FFI. This is called an autosomal dominant inheritance. If an individual had the mutated gene, they had a 50% chance of passing it along to each of their offspring. There's also another form of FFI called sporadic. However, there have only ever been 24 reported cases known as of 2016. This form is very rare, and there are no changes in the PRNP gene. The individual's Pyron protein, PRP, it spontaneously alters and takes on new shape, therefore causing a chain reaction in other neurons changing the shape of the PRNP, resulting in the symptoms. Symptoms typically begin between ages of 32 to 62. They include dementia, insomnia, the onset of phobias, significant weight loss, uncoordinated movements, hallucinations, and eventually the inability to walk or even talk. Diagnosis for FFI typically follows any type of rapid progression, including dementia, sleep disturbances, as well as mood changes. With any combination of those three, a sleep study or a PET scan will take place. Genetic testing can also confirm that that mutation exists within the gene if there's family history or any abnormal results during a sleep study or PET scan. Are there treatments for FFI? There are some. Vitamin therapy, meditation, anesthesia, GHB. Unfortunately, treatments may only help with the symptoms. They can provide some relief or some sleep to gain a sense of rest. However, treatment's not guaranteed to work for every patient. In fact, vitamin therapy can help with some of your deficiencies. Meditation helps to calm and relax you, but really should be started early on. Anesthesia can place you into a sleep to help calm the restless, irritable behavior that takes place during insomnia. GHB has only been effective in calming and relaxing a few patients. There's no treatment to assist on all symptoms. What's my prognosis? Sadly, there's no treatment to correct this point mutation that occurs within the PRNP gene. There's no treatment to stop or prevent the symptoms from occurring. There's nothing in play to prevent an individual carrying the mutated gene from suffering from the prognosis. There's no cure for FFI. Each individual who has this disease will die. Their expectancy from time of onset is an average of 12 to 18 months. However, there have been cases that show a few months from the onset of symptoms, up to several years. It truly is a case-by-case situation. Research, however, continues with hope for a better prognosis in the future for those who suffer with fatal familial insomnia.